Hello everyone, welcome back to the channel. Today, we're going to learn one of the most confusing terms in the U.S. healthcare for medical billing, which is deductible. Let us begin with a simple question. What exactly is a deductible? In the U.S. healthcare system, a deductible is the amount of money you must pay annually for your medical care before your health insurance plan begins to contribute financially to cover your medical expenses. As per RCM, you are responsible for paying all of the initial covered medical expenses until your deductible amount is met. For example, let's say you have a $2,000 deductible for this year. You go to the hospital and your treatment costs are $1,000, which is less than your deductible. You'll have to pay it yourself. But if you go to the hospital and your treatment costs are $3,000, which is more than your deductible, you'll pay the first $2,000. Then, your insurance company starts sharing the cost after paying the deductible. It is based on your coinsurance. It may be 80% and you pay 20% as coinsurance. That first $2,000 is your deductible. As an AR caller, you must keep in mind that the deductible starts fresh at the beginning of each policy year. So, even if you met your deductible last year, you will have to start again this year. Some preventive care services like vaccines, annual exams, and preventive checkups may be free. No deductible applied to these services, so always verify before billing or discussing patient balances.